Welcome. If you're getting ready for your certification exam, you know that the non-blood specimen section can be kind of tricky. So in this explainer, we're going to do a super high-yield review of the most critical procedures to help you absolutely ace those questions.
I get it. You look at that exam guide, you see all the different types of non-blood specimens, and it can feel like a lot. But don't you worry, we're going to cut right through all the noise and focus on exactly what you need to know so you can walk into that exam feeling totally prepared.
First up, let's talk about GI specimens. For these, it really all boils down to two key things: giving the patient super clear instructions and then handling that sample correctly. If either one of those things is off, the whole test result could be invalid. Okay, this is a classic exam topic, comparing the GFOBT and the FIT tests. The most important thing to remember for your exam is why the patient instructions are so different. See, the guaiac test just detects heme, which is in red meat, right? So that could cause a false positive. But the FIT test, it's way more specific. It only detects human globin. And what does that mean? No diet restrictions. That's a huge deal for the patient, and it's an absolutely critical fact for you to know. So these are the big three errors that happen with stool collection. Any one of them can get the specimen rejected by the lab. For your exam, the main takeaway is that your number one tool to prevent all this is providing crystal clear instructions to the patient. I mean, both written down and explaining it out loud. Now, this is a big one. It's a hard and fast rule, and it's the perfect kind of question for an exam because it's so specific. Just think about it. The lab is testing for an active diarrheal disease. So a formed stool just doesn't fit the picture. If it's formed, it's rejected. It's that simple. All right, let's switch gears and look at swabs. With these, technique is absolutely everything. You have to get it right for an accurate diagnosis, and you can bet the exam is going to test you on these precise steps. This lays out the procedure perfectly, but let's really zero in on step 4, avoiding contamination. This is where things most often go wrong. And why is that so important? Well, if you accidentally touch the tongue or the inside of the cheek, all you're collecting is the normal bacteria that live in the mouth, and those can easily overgrow the group A strep you're actually looking for. That's a huge testable concept. When you hear buccal swab, I want your brain to immediately think the 30-minute rule. This is, without a doubt, the single most important instruction for the patient. Why? Because it stops the sample from getting contaminated. You want to collect a clean sample of their cheek cells for DNA testing, not the remnants of their morning coffee. Okay, let's move on to the tuberculin skin test, or the Mantoux test. This one is all about two things: precision in how you place it and timing for when you read it. Let's break down exactly what you need to know for the exam. Pay close attention here. That really shallow 5 to 15 degree angle, that's on purpose. It's designed to put the PPD right under the skin. And that little bubble that forms, the wheel, that's your instant feedback. A nice 6 to 10 millimeter wheel tells you, yep, I did it correctly. If you don't get a wheel, the test isn't valid and you'd have to do it again. This number, you absolutely have to know this for your exam. It is completely non-negotiable. See, the body's immune reaction needs time to actually develop. If you read it too early, be 48 hours, you could get a false negative. But if you wait too long, after 72 hours, the reaction starts to fade, and you could get a false negative then too. That 2 to 3 day window is mandatory. And this brings us to the final crucial step: interpreting the result. Now remember, you are measuring the induration. That's the hard, raised bump that you can actually feel. You're not measuring the redness around it. For your exam, you've got to know these 3 different risk groups and their specific millimeter cutoffs for what counts as a positive test. So we've gone through stool samples, swabs, and a skin test. Pretty different, right? But what's cool is that a few core principles apply to all of them. Think of these as your universal safety net, the fundamental rules that guarantee accuracy and patient safety every single time. This right here, this should be your mantra. These 3 actions are the absolute foundation of your job as a phlebotomist. Seriously, if you get these right every single time, you will prevent the huge majority of errors that can happen before a sample ever even makes it to the lab. It's one of the most important things you do. Okay, take a breath. You've just reviewed the critical, high-yield points for these really important non-blood specimens. You get the procedures, you know the common mistakes to avoid, and you know the key numbers. Now, go into that exam with the confidence that you know what really matters. You are prepared, you've got this. Good luck!